Nine symptoms of meningitis that every parent and child should know about. Meningitis is a disease connected with the inflammation of the protective membranes covering the brain and spinal cord. The etiology of this disease can vary, but the symptoms of different types are similar. It is considered that children are most susceptible to this disease. This is why, in this video, we have decided to remind parents about the ways of detecting meningitis and which symptoms should be paid attention to primarily. If you notice these signs in anybody older than 2 years old, pay attention. Number 9. Sudden fever. One of the symptoms of meningitis is a fever that starts suddenly. A child starts to shiver and keeps complaining that they always feel cold. The sick person's temperature goes up very quickly, up to 100.4 degrees Fahrenheit, and it very often becomes an uphill task to bring it down. However, due to the fact that this symptom is a sign of many other diseases, one should pay attention to other factors showing changes in a child's condition as well. Number 8. A severe headache, different from usual ones. Headaches caused by meningitis are often not just strong, but unbearable. Moreover, the pain can impact a patient's neck as well, but due to the splitting headache, he simply can't pay attention to it. Number 7. Double vision. A person affected by meningitis cannot focus their eyesight, which is why their vision becomes doubled. They are also likely to have difficulties with concentration or feel confused. Number 6. Fast breathing. People sick with meningitis may start to breathe very quickly as if they don't have enough air. What is more, their skin turns pale and their feet and hands become cold. Number 5. Stomachs, nausea, and vomiting. A person who has contracted meningitis loses their appetite. This happens partially due to constant nausea that can be followed by stomach aches and vomiting. Add a terrible headache to the equation. Would you choose to grab a bite? Doubt it. Number 4. Sensitivity to bright light. Another sign of meningitis is the fear of bright light because it causes watering of the child's eyes and nausea together with a headache that becomes stronger. Number 3. Rigidity of occipital muscles. A child with meningitis may be in a particularly recognizable position, lying on their side with the head thrown back and the legs bent. Attempts to unbend their neck are often not successful. Number 2. Inability to unbend legs. Even if you manage to bend the child's head to their chest, their legs instantly bend at the knees and they are impossible to unbend from this position. This phenomenon is called the Brudzinski neck sign. With meningitis, the Koenig sign also appears, where one cannot completely extend their leg if it's lifted up at approximately 90 degrees. Number 1. Unfading skin rashes. Skin rashes are also possible with some types of meningitis. The thing is, blood vessels become damaged because of poison released by the bacteria. If this is the case, you can notice a rash looking like pinpricks. This rash can be of different colors, from purple to light pink. It can appear anywhere on the body and look like a slight bruising at first. Not to panic in vain, here is a simple test. With its help, it's very easy to detect a plain rash that is not connected to meningitis. Take a clear glass, apply it to the rash, and press it firmly against the skin until it turns pale. If the spots turn pale together with the skin, the person doesn't have meningitis. If the rash doesn't fade, then you should seek medical attention. So, these signs typically appear in about 1 week after the exposure. Certainly, a person might not have all the symptoms. The most alarming should be high fever and headache. However, if you have a newborn, it's much harder to detect the reason for their crying. After all, they can't tell you what bothers them. If this is the case, watch out for these symptoms. Your baby is constantly crying, and the sound is unusually high-pitched. The skin of the baby's body may develop some strange tone, bluish, yellow, or very pale, or become blotchy. The infant has a very high fever, or, on the contrary, the temperature is lower than normal. They refuse to eat. The baby may sleep too much or be nervous and irritable. The neck and the whole body are very stiff. In fact, their whole body can be arched backward. You notice a bulged fontanelle, a soft spot which is located on top of the head of a baby. Take into consideration that, unlike any other sick baby, a baby with meningitis may start to cry even harder if you take them into your arms. What to do? Meningitis is a dangerous disease, which is why if any of these symptoms are detected, you should instantly call an ambulance. You should provide the sick person with rest, quiet, and dimmed lights in the room until the doctor arrives. You should inform the doctor about all the detected symptoms. It is highly discouraged to refuse hospitalization when there is a suspicion of meningitis, because it's possible to treat it effectively only in the inpatient department. Why? Let's have a closer look at this disease, its causes, and the ways to avoid it. What is meningitis? When a person suffers from meningitis, the membranes of their brain and spinal cord are swollen due to bacterial, viral, or fungal infection. Out of all the types of meningitis, the bacterial one is the most serious. Without proper and timely treatment, it turns fatal in just a few days. The thing is, bacteria get into the bloodstream and spread to the spinal cord and brain. As a result, it causes acute meningitis very fast. Viral meningitis is the most common type and isn't so dangerous. Its course is milder and the disease can disappear on its own. A group of viruses under the name of enteroviruses, most typical for late summer and the beginning of fall, causes this illness. The type of meningitis that is developing more slowly, well, as slowly as within 2 weeks, is considered chronic. The signs of such types of the disease are similar to the ones of the bacterial type of meningitis: fever, vomiting, headache, confusion. They just last longer. All these types of meningitis are contagious, and most of them are extremely dangerous. It may strike anyone, but some factors increase the risk of developing this disease. The absence of the necessary vaccination. Do not skip vaccinations. There is a special schedule of injections for children and adults that you should follow. There is also the factor of age. Children younger than 5 years old are the most susceptible to viral meningitis. Bacterial meningitis is typically diagnosed in young people under 20 years old. Pregnant women are at a higher risk of contracting meningitis than other adults. Stillbirth, premature delivery, and miscarriage are dreadful, but unfortunately very likely scenarios in such a case. Another group of risk includes people whose immune system is weakened or compromised, those with AIDS, alcoholism, diabetes, and so on. Moreover, people with a removed spleen are to undergo additional vaccination to make the risk of developing meningitis minimal. Don't take the disease lightly. Even if it doesn't turn out fatal, the complications it can lead to are numerous and severe. Remember that if your child or you has meningitis which is not treated properly, there is an extremely high chance of permanent neurological damage. It can include the loss of hearing, the disability to learn, seizures, difficulties to memorize things, problems with walking, damage to the brain, kidney failure, and shock which can lead to death. However, if the treatment is prompt and proper, any patient can recover completely. Just like with any other disease, the bacteria and viruses causing meningitis spread when people sneeze, cough, kiss, share toothbrushes, cigarettes, or eating utensils. Follow these precautions to prevent the disease, and don't forget to teach your kids. Washing hands. If you do it carefully, it will prevent germs from spreading. Tell your kids to wash hands frequently, especially before they have a meal, after they use the toilet, pet an animal, or spend some time in a public place with a lot of people around. Proper hygiene. You must definitely know it, but spend some time to explain to your children that they should never share their food, drinks, and straws in them, eating utensils, toothbrushes, and cosmetics, especially lip balm. Maintaining your immune system. You should have some physical activity regularly, get enough rest, follow a healthy diet, which includes a whole lot of grains, fruits, and vegetables. To avoid all unnecessary risk if you are pregnant, cook meat at no less than 165 degrees Fahrenheit. Don't buy cheeses from milk that is unpasteurized. Make sure you check the label. Now you know the dangers this disease hides. Just have a look at these statistics. Every year, 4,000 people in the USA contract bacterial meningitis. From 10 to 15% of them die. 1 out of 5 of those people who survive get permanent disabilities, loss of hearing, brain damage, or amputation of a limb. 21% of all cases happen to children, teenagers, and young people not older than 24 years old. Proper and timely antibiotic treatment increases the chances to survive up to 85 to 90%. Has this information been helpful for you? Give us a like. The more likes this video gets, the more people will see it and be warned. Do you know anything else about this disease? Write to us in the comments.